Enough to kill every American. DEA details just how bad the fentanyl crisis is in America. Fentanyl is the leading cause of death for Americans between the ages of 18 and 45. The U.S. Drug Enforcement Administration, DEA, said on Jan. 17. The agency is calling fentanyl the deadliest drug threat our country has ever faced. As the DEA marks its 50th year of being the only federal agency dedicated to fighting drugs, it released statistics related to the drug and how much it really has infiltrated the U.S. In just 2023, the DEA seized more than 77 million fentanyl pills and almost 12,000 pounds of it in powder form. This is the most fentanyl seized by DEA in a single year. It amounts to more than 386 million deadly doses of fentanyl, enough to kill every American, the DEA said. The agency says the pills nowadays are more potent and deadlier than ever before. Lab testing showed in 2023 that 7 out of 10 pills had a potentially deadly dose of the drug. This is an increase from 4 out of 10 pills in 2021 and 6 out of 10 pills in 2022. A potentially deadly dose is considered just 2 milligrams of fentanyl, which is approximately the amount that fits on the tip of a pencil, the agency said. The Centers for Disease Control and Prevention, CDC, predicts there will be a record number of drug poisonings in 2023. In the CDC's last estimate for the 12-month period ending in June 2023, there were 112,123 American deaths. Nearly 70% of these drug poisonings are from fentanyl, the DEA said. What's the DEA doing about these staggering numbers? Here is the agency's explanation. DEA's mission is to save American lives by defeating the 2 cartels that are responsible for the vast majority of fentanyl that is flooding our country, the Sinaloa cartel and the Jalisco cartel. DEA has built a new strategic layer of counter-threat teams to focus on each cartel and the illicit finance networks that fund them both. These counter-threat teams draw on the intelligence from our 334 offices around the world to map the cartel's global networks and to identify targets for investigation and prosecution. While the cartel's operations are based in Mexico, DEA has identified more than 50 additional countries where these criminal networks operate. DEA has also traced the cartel's global supply chain around the world. The cartels purchase chemicals from companies in China, mass-produce the fentanyl in Mexico, and then traffic and distribute finished fentanyl widely throughout the United States. In 2023, DEA took actions to disrupt every step of this fentanyl supply chain, from bringing the first-ever charges against Chinese chemical companies and their owners for supplying precursor chemicals, to charging and extraditing leaders, enforcers, and associates of the cartels in Mexico, to tracking down the criminal organizations and individuals in our communities responsible for the last mile of distribution of fentanyl on our streets and on social media.
Top local drug threat. Fentanyl, a strong synthetic opioid, is the Philadelphia area's top local drug threat, according to local officials. In 2021, Philadelphia had a total of 1,276 overdose deaths, according to data from the Philadelphia Department of Public Health. In addition, 82% of the 2021 overdose deaths in Philadelphia included fentanyl. This powerful drug has also been found in cocaine, methamphetamine, counterfeit pills, and others. Rise in unintentional overdoses. This chart examines unintentional overdose trends in Philadelphia through 2022. As the overdose crisis continues to worsen, Philadelphia and its people are impacted every day. Understanding evolving trends in overdose fatalities is pertinent to the development of culturally responsive resources, harm reduction materials, and public health initiatives that are necessary to prevent overdose deaths from occurring. In 2022, there were 1,213 unintentional drug overdose deaths, an 11% increase from 2021. This increase was most prevalent among non-Hispanic Black individuals, for whom overdose deaths increased nearly 20% from 2021, 542, to 2022, 649. While most overdose deaths continue to involve opioids, deaths involving stimulants, both with and without the presence of opioids, increased 17% from 2021, 851, to 2022, 996. Emerging threat xylazine, reported as an adulterant in an increasing number of illicit drug mixtures, has also been detected in a growing number of overdose deaths. It is commonly encountered in combination with fentanyl, but has also been detected in mixtures containing cocaine, heroin, and a variety of other drugs. However, xylazine is most frequently reported in combinations with 2 or more substances present. In addition to its presence in drug combinations, xylazine, often known as tranq, is used on its own, though this is less frequently reported. Limited scientific research has been conducted on the effects of xylazine on the human body, but anecdotal reports indicate that users experience effects similar to opioids. Xylazine can lead to depression of the central nervous system, along with other adverse effects, as reported in scientific and medical journals. The presence of xylazine in illicit drug combinations and its detection in fatal overdoses may be more widespread than reported, as a number of jurisdictions across the country may not include xylazine in forensic laboratory or toxicology testing. One pill can kill. The Drug Enforcement Administration warns the American public of the alarming increase in the lethality and availability of fake prescription pills containing fentanyl and methamphetamine. International and domestic criminal drug networks are mass producing fake